Hello, I'm Alistair Forbes. I'm Professor of Medicine and Nutrition based in the University of Tartu in Estonia with an Emeritus Professor title from the University of East Anglia in the UK. What are oral nutrition supplements? Depending on where you live and work, oral nutrition supplements come in many shapes, sizes, and packages. Oral nutrition supplements are protein, energy, and other nutrient-dense products specifically designed to increase nutritional intake. These should be used when the diet alone is unlikely to be adequate to meet nutritional requirements. They may include energy and protein-enriched drinks, for example, milk, soy, protein-fortified juice flavors, but also powders, soups, and desserts. Who should be offered oral nutrition supplements? Well, first of all, everybody with a recent hip fracture should be offered oral nutrition supplements. Why? Well, in the definition on the previous slide, you learned that ONS should be offered when diet alone is unlikely to be adequate to meet nutritional requirements. And many studies show that hip fracture patients don't meet their nutritional requirements before and after surgery. It usually takes patients a few weeks for intakes to improve. And for some, the dietary intake can take a lot longer to recover, and in some cases may never recover. That's why evidence-based guidelines and care standards support offering all hip fracture patients oral nutrition supplements from the time of admission, and keep offering them until the patient's assessed as well-nourished and is eating and drinking sufficiently. That is, of course, as long as they are in line with the patient's treatment goals and overall care plan. Secondly, we should think about anybody else at risk of malnutrition or already malnourished. If they're unlikely to meet requirements through high-protein foods and fluids alone, they should also be offered oral nutrition supplements. How can we measure this challenge of received oral nutrition supplements? Well, there are a few simple ways we can check if patients are actually receiving oral nutrition supplements. First of all, we can audit patient records, patient charts, their notes. Look at the notes. Is there documentation that oral nutrition supplements were provided? Has their intake been assessed? Secondly, we can ask patients. For example, 10 patients, find a few people who can remember well and ask them, are you receiving oral nutrition supplements? Has anybody asked you what they're for? How much of them are you taking? And third, we can survey 10 clinicians, 10 of our colleagues. At a team meeting, do a quick poll. Ask your own team, what proportion of our hip fracture patients have received oral nutrition supplements and had their intake assessed within 72 hours of their surgery? This is quick, and these quick checks help us know if our nutrition care is being delivered as planned. Let's look at an example, the story of Mrs. D. If you've already seen Mrs. D's case in another unit, you might still want to see it to think about opportunities for improvement specifically in receiving oral nutrition supplements. As you watch, think about what could have been done differently and how her experience might have been improved. Why is received oral nutrition supplements one of the simpler 6 priorities? Received oral nutrition supplements is a simpler 6 action. Why? Because evidence-based guidelines and care standards support offering oral nutrition supplements to all patients with a hip fracture, at least until they've been assessed as well-nourished and not at risk of malnutrition. However, across global regions, most patients with hip fracture do not receive oral nutrition supplements. And we know that unless we do this, hip fracture patients are unlikely to have better nutrition and better outcomes. Sometimes you might see oral nutrition supplements not being used. You may even notice a small pile of them next to a patient's bed. This is often a good time to ask the patient a few quick questions. You can check whether they know what the supplements are for and why they are receiving them. Or ask if their doctor, their physio, or their nurse has explained why these are in fact one of the most important medicines to help them meet their goals. Many patients don't drink the supplements because they don't know they need them or how they can help with recovery. It's much better to explain why the supplements are provided and how they help than just change the flavour from chocolate to strawberry, although you might do that too. Why offering oral nutrition supplements matters to patients. Let's look at why oral nutrition supplements are important from the patient's point of view. It's not just about calories or numbers on a chart. It's about improving experiences, helping people feel seen, supported, and that they're getting the best care that aligns with the evidence. It makes them feel that they can do something active to support their own recovery and reassure families and carers that patients are more likely to be getting enough nutrition to help recover from their surgery. It's also about improving the health outcomes that matter to patients. Oral nutrition supplements help to maintain the energy and strength needed for rehabilitation, to prevent loss of muscle and lower the risk of malnutrition and other complications. Oral nutrition supplements also help to promote faster recovery and give people a better chance to return home and stay at home. Why offering oral nutrition supplements also matters to health workers, hospitals, and health systems. Let's take a look at why providing oral nutrition supplements matters to teams and the wider health system. When patients are offered oral nutrition supplements, they're more likely to meet their protein and energy needs. Oral nutrition supplements help maintain body weight, muscle, and nutrition status. They also help to reduce complications and support faster recovery. This means shorter hospital stays, fewer readmissions, and better chances of reaching the rehab and discharge goals. So for hospitals, this frees up beds, reduces pressure on the staff, and strengthens performance on safety, audit, and benchmarking indicators. Received oral nutrition supplements is a key, simpler action that leads to better nutrition and better outcomes for everyone. Now it's time to reflect. Why do you think it is, or isn't, important for hip fracture patients to receive oral nutrition supplements? Think about the things that matter to patients, communities, or populations, healthcare workers, or funders and policymakers. Just put in a few of your own thoughts. This isn't assessed, it's just to get you thinking. Once the video stops, just click on the link to the reflection activity.